Hello, my name is Madeline Trudell, and I am a fourth-year nursing student attending York University. I am currently enrolled in a community health course that has granted myself and my peer, Naba Sukar, the privilege to work with the community to create a change initiative to improve the health of its members. We've been paired with a long-term care home in Newmarket, Ontario, and through collaboration with the home, we have found that staff are experiencing stress and showing risks for burnout. These findings align with many long-term care homes in Ontario. Because of this, we have created a 3-part series that will teach individuals about stress and burnout, workplace violence, and mindfulness as a stress reduction strategy. The following video is aimed at 1. Examining the current issue of stress and burnout in healthcare. 2. What does stress look like in the workplace and strategies to handle it? 3. What is burnout and how can you prevent it? And 4. Resources for staff. Did you know that in 2017, an article in the Canadian Medical Association Journal reported that staff working in nursing homes had notably worse mental health than the general population? Most of you watching this video probably work in the profession, meaning that you already have a sense of how working with a population such as residents living in nursing homes can affect your own health. Nursing home residents are a highly vulnerable and medically and socially complex group of individuals to care for, which can create great amounts of stress for caretakers. There are many factors that affect stress in the workplace, but as just one person, what can you do to ensure your own safety and residents' safety? To start, having an understanding of workplace stress and signs of burnout are protective factors that will help you understand your own health and how to take care of it. So what does workplace stress look like and how can you combat it? The National Institute for Occupational Safety and Health defines occupational stress as the harmful physical and emotional responses that occur when the requirements of the job do not match the capabilities, resources, or needs of the worker. In healthcare, there are many factors that can result in stress. Some things to be aware of while at work are an overload of work. This may cause emotional or physical exhaustion, decreased quality of work, and the inability to complete tasks on time. While at work, it is important to know your rights, and this includes how many residents you are responsible for. In Ontario, there is no minimum or maximum requirement in long-term care homes for staffing, but knowing your home standards is a starting point. For example, the long-term care home in Newmarket, Ontario has standardized staffing ratios of 11 residents per personal support worker on days and evening shifts, and 23 residents per personal support worker on night shifts. They also have a designated member of staff for bathing on days and evenings to support patient loads. Registered practical nurses' patient ratios on days and evenings are 31 residents per 1 RPN. Does this sound similar to your agency? Check with your management to clarify what ratios are in place for your home so that you can be aware of what your workload responsibilities are. Uncertainty around job responsibilities. Do you experience instances while you're at work where you question what your role is in a particular situation? Do you ever have members of staff ask or tell you to do things you are uncertain you're responsible for completing or feel unsafe performing? Check with members of management to ensure you have a clear and concise role definition to ensure your safety. If this definition does not exist, ask for collaboration with management to create clearly defined roles. Poor interpersonal relationships. Do you have a hard time communicating with members in your workplace? Do you find collaboration with team members difficult? Is bullying present? Workplace relationships and strong communication are vital aspects to creating a relational process of sharing information between team members, which creates new ideas, insights, and positive changes in the work processes. To foster better relationships in the workplace, practice active listening skills, keeping yourself open to hear what others have to say. Try to be aware of your personal biases and how they influence the way you interact with the outside world. Ask your team members questions and continuously seek feedback. If you experience bullying at work, confront the individual in a calm manner and ask what is bothering them and if there's anything you can do to help. Engaging in positive dialogue with someone who is bullying you often helps to foster a more positive relationship. If this does not work, consult with management and advocate for a zero-tolerance policy on violence in the workplace. Unfair management practices. Do you feel unheard by management? Most members working in long-term care homes are supported by unions. For registered nurses in Ontario, they are protected by the Ontario Nurses Association. On their website, they have sections for contracts and rights, as well as member services. For staff such as registered practical nurses or personal support workers, your unions can vary. For the long-term care home in Newmarket, Ontario, CUPE is used. You can refer to their website for resources to understand your rights. Go to the Members Resource section and select the All Resources button to get more information. Unions also have representatives called stewards that are supportive members that can aid you in the use of the union. Get to know your stewards so that they may help you in future difficult situations. It is important to know your rights as an employee, as knowledge empowers you when systems aim to disempower you. Knowing when you can say no, when you can ask for help, and knowing the responsibilities of management will help to create a better work environment for everyone. Resident violence is another highly impactful job stressor that long-term care home staff often experience on a daily basis. In part 2 of our 3-part series, we will be taking an in-depth look at this issue. When you're finished this video, please take a look. So these are just a few of the many job stressors that long-term care home staff face. The most important thing to remember is know your rights and advocate for yourself. Knowledge is a powerful tool that you can carry with you anywhere you go. Understanding safe work environments, policies, and laws helps you to keep not only yourself safe, but your residents. So we've talked about occupational stress, but what is burnout, and what does it mean for long-term care home workers? An article published in the Journal of Applied Gerontology states that burnout occurs when an individual has been exposed to prolonged chronic emotional and interpersonal stressors. Burnout is often defined by 3 factors: feelings of cynicism or detachment from one's job, this is referred to as depersonalization, exhaustion, and feelings of lack of accomplishment and ineffectiveness. Some of the more common forms of stress that act as risk factors for burnout are prolonged periods of work overload and high emotional loads of interpersonal relationships. It is also important to note that the staff who provide care to the geriatric population in long-term care homes are exposed to some of the largest numbers of factors that can lead to burnout. The pressure of time constraints, confrontation with suffering, physical stress, short staffing, and caring for individuals with dementia are all things that many long-term care home workers face that influence the development of burnout. So what are some of the things that you yourself as a staff member working in a long-term care home can do to help prevent burnout syndrome? To start, use the strategies discussed for stress reduction mentioned earlier in the video. Reducing the amount of stress you experience on the job will help protect you against burnout. Caring for residents who have dementia is another impactful risk factor that many of you experience every day at work. The cognitive impairments and psychological changes that residents living with dementia experience makes the job for long-term care staff intensive and emotionally demanding. A strategy supported by literature that shows high evidence of being a successful burnout protection technique, especially in relation to emotional stress, is mindfulness as a stress reduction strategy. Mindfulness will be discussed in part 3 of this 3-part video series, so please take the time to watch it and learn how you can use it as a tool to prevent burnout. In Ontario long-term care homes, 80% of residents will exhibit behavioral symptoms of dementia, and 46% of residents exhibit some level of aggressive behavior related to their cognitive impairment or mental health condition. Therefore, understanding violent residents and how to care for them is another important skill for combating burnout. Part 2 of this 3-part video series focuses on violence in the workplace related to residents living with dementia. Please refer to this video to learn more. Now that you've learned about stress and burnout and some ways that you can prevent or manage them in the workplace, what are some resources available to you? As mentioned earlier, if you work at the long-term care home in Newmarket, Ontario that this video was specifically created for, you either belong to the union of CUPE or ONA. If you belong to CUPE, check out their website and learn about the resources they have available to you. One of the sections under Members Resources is Violence. It's not part of the job. Here you can find tips for staff and learn about your rights. They even provide you with a violence prevention kit that tells you how to prevent violence in the workplace, how to develop a workplace violence prevention policy, and more. They also provide members with a checklist for how to respond to a violent incident. If you belong to ONA, they also provide a wide array of resources for staff. Check out their Workplace Violence section to learn more. Here you can find the Ministry of Labor's Occupational Health and Safety Act related to workplace violence and harassment, a guide for how to report violent incidents, and more. Another resource available to the staff of the long-term care home in Newmarket, Ontario is the Employee Assistance Program, which is through the Canadian government. Here you are provided with a fully covered service, such as e-counseling, telephone counseling, short-term professional counseling, and referrals to an appropriate external community resource if the issue is not short-term or specialized treatment is required. Stress and burnout are important topics for long-term care homes to be aware of. Burnout not only affects the well-being of professionals, but also entails economical consequences, such as diminished productivity, decreased job performance, and absenteeism. We hope that you found this video useful and that you learned about protective tools that you can apply in your everyday work life. Now that you've finished video number 1, please take the time to watch videos 2 and 3. See you next time!